Today I'd like to talk about a case study of a couple of patients that we have seen in through the clinic here where unbelievably we've been able to get full neck range of motion back without actually touching them. Sounds unbelievable and kind of incredible, right? But it's as true as I'm standing here. So what patient would we actually treat without touching them? Well, the answer is pretty simple. It's those patients whose systems are so wound up that even thinking about movement might hurt. So when you've got someone who's extremely irritable, okay, now I'll be clear here, the word irritable means very small input, very large output, okay, as opposed to irritating, and we all know someone who's like that. But when we're talking about someone who's irritable, that's what we're talking about. So if someone has a very severe long-term pain condition, and even touching the part that is affected might make them sore, or even thinking about making that part move makes it sore, then we actually need to drop back even further and not touch these patients, but rather find other ways to stimulate the movement, which is pain-free, with the movement that might be affected. So the most common ones that we see are actually people that have neck pain and often headaches and migraines that come as a result of that neck pain. And what we find is that when the people are trying to move, they can move, but it hurts all the way through range. Like, it doesn't matter how far they turn, it just hurts so much. Some of these people can't even turn more than, say, 10 degrees, where they're like that, and it just hurts, it becomes dizzy, it's really painful. What I actually ask these patients to do in the clinic is to do one of two things: either close their eyes and imagine that they're turning to the left or turning to the right, or looking up or looking down. So you might want to try this at home. So closing your eyes and imagining that you're turning towards the left and coming back towards the camera, and turning towards the right and coming back towards the camera. So if you do that and you can find either that it's painful when you're doing it, or you find it's more difficult turning one side to the other, even imagining doing it, then you might be the person that I'm talking to. Because if there is a lot of severe pain, you've tried a lot of different types of treatment before, it hasn't quite worked for you, then this is a good place to start. If you can't imagine the movement without it either being painful or causing other dizziness or nausea type symptoms, or if you actually physically can't imagine the movement, then that's something that we do need to retrain. Here's the second thing, while Ryan's talking in the background, that we're talking about knowing if hands-off treatment is good for you. So the second thing is actually watching people doing the movement that hurts you. So say for example you've got an issue with your neck, and particularly when you're looking down towards the floor. What I'd like you to do is to look at the camera right now, look at the screen, and watch me do the movement, okay? So just watch this for a minute. Keep watching the screen. Okay, that squeaky noise that you heard while I was looking down was Ryan's chair, which is really funny. Now, when you were doing that, okay, when you're watching the screen, what did you feel in your neck? Did you feel pain in your neck? Did you feel like an anxiety type of feeling? Did you want to look away from the screen because it's like, oh, I don't really like watching that? Again, if that's you, then you might be the person that I'm talking to, that it's someone that needs the treatment without actually touching the neck. It actually needs to more retrain the movement in your brain first before we do any type of hands-on manual therapy type movement. So that's just something to consider. We've seen scores of these patients over the years, and we're getting much better at being able to identify who these patients are through the work of David Butler, Lorimer Mosley in Adelaide, and a few other researchers around the place. We are seeing this more and more, that we need to retrain the brain first before we actually get our hands on or do real exercise with weight or even active or passive movement. So it's just something to consider. If it's really painful, if you can't imagine the movement, even if watching someone doing the movement causes discomfort, then this might be the video or the treatment regimen that you need. If you'd like to have a chat to us about it, there's the link in the comments below about how we treat neck pain, and also the contact page is underneath as well in this status. Send us an email, send us a text, send us a message, and we can have a chat to see if there's something that might be able to help you out. Hope that's been interesting, hope that's been helpful, and we'll see you again next time. Cheers and bye for now.